Will democracy survive the next couple of years?
And essentially we are the same.
And there are so many needs that Minnesota has.
What people are saying they need right now.
Access to Democracy is made possible in part by a donation from Firefly Credit Union. Firefly is the new name of U.S. Federal Credit Union, which has proudly served the financial needs of the greater Twin Cities community since 1925. At Firefly, we guide our members forward and give them the power to chase dreams by delivering the financial solutions they need to get ahead. From checking accounts to mortgages, we'll light the way. We are Firefly Credit Union, and this is life illuminated. By Thomson Reuters, providing legal professionals with intelligence, technology, and human expertise they need to find trusted answers. Thomson Reuters, the answer company. Online at thomsonreuters.com. And Dr. Charles Crutchfield of award-winning Crutchfield Dermatology in Eagan. Acknowledged as one of the nation's best physicians, a Minnesota native who trained at the Mayo Clinic, Dr. Crutchfield personally treats all patients and states that experience counts and quality matters. Crutchfield Dermatology, look good, feel great, with beautiful skin.
Welcome to Access to Democracy. I'm Bill Raker, guest host for this edition of the program. We're excited to welcome as our guest today Erin Parrish, who's Associate State Director for Advocacy and Outreach for AARP here in Minnesota. She's going to talk a little bit about AARP and about her role in the advocacy for the programs that AARP is a supporter of. So welcome, Erin. Tell us a little bit about what your role entails with AARP.
My role at AARP essentially is to support our members and our advocates in effectively lobbying for the issues that are important to them at the state capitol as well as with members of Congress. So I provide them with resources, with information. I train them in how to be effective citizen advocates, and then also go out and talk to our members about what's going on at the state capitol and how they can take action.
Well, I think that's a very important job that you have. You know, many people are familiar with AARP at a very high level, but perhaps don't know the kinds of activities the AARP is engaged in, like advocacy for the consumers. Now, AARP is a nationwide organization. They have some 38 million members. Do you happen to know what the breakdown is for the number of AARP members here in Minnesota?
I do. We have about 670,000 members in Minnesota.
Amazing, 670,000. So how does one become eligible to be an AARP member?
Well, you have to be 50 or older. That's the first thing.
Well, that's a young age these days.
Yes, and it is young. And you know, there are very different needs with our members. Those who are 50 to 64 have different interests and needs than those who are 65 and older. But one of the reasons we have a broad membership is because we know that when people reach the age of 50, that's when they start to think about aging and retirement. And you can't start thinking about those things when you're 67.
That's a little late, isn't it?
Yes. But you know, people joke about AARP and that, you know, we'll find you when you turn 50. But you know, that really is the age requirement, or the one requirement.
That's just the single requirement.
Yes.
You know, AARP, American Association of Retired Persons, I think many people think because of the retired word being in the name that a person has to be retired in order to be a member of the organization, but you just clarified that that's really not true.
That's not true at all.
Well. Well, we hope the organization continues to grow because it does a lot of really good things, some of which we're going to talk about here today. And advocacy being an extremely important activity to be engaged in these days, with a lot of things going on with the legislators and the regulators that impact the consumer, the citizen. And I think you could clarify that many of the programs that AARP advocates for are not just for people over 50
Right.
or people who are retired, but could apply to just about anyone, and the general populace benefits from those. And I think we're going to talk about one of those as we get into it. But now that we understand a little bit more about what your role is, I know you and your cohorts were very active during the last legislature and previous legislators as well, but I think there were some great successes that you enjoyed in the last session. Could you tell us a little bit about what those are and what the impact of getting those bills passed will be?
Yeah. Well, we're very proud of our work last legislative session. Back in 2017, there was a series from the Star Tribune that broke about really kind of a broken regulatory system in our long-term care facilities. It uncovered some horrific stories of abuse that had gone unreported and uninvestigated, and a number of individuals were harmed. Some lost their lives. Family members didn't really get the justice that they needed. What was uncovered is that our regulatory system around long-term care facilities was extremely fragmented. And particularly is that Minnesota did not license assisted living facilities, so there really weren't consumer protections that existed there. So then Governor Mark Dayton had appointed AARP to lead and convene a consumer work group to figure out what exactly was going on and what our recommendations were for fixing that. We worked tirelessly with a number of partners to pass a number of those recommendations. It was not a one-year thing, it was a 2-year fight at the Capitol. But last year we claimed victory after coming to consensus with the long-term care industry on a bill that prevents elder abuse. Essentially, the bill puts in place some really important consumer protections and starts licensing assisted living facilities.
That's a very good thing to have in effect, and congratulations to you and those who worked with you to help achieve that. You in your efforts, you do partner with some other organizations here in the state, don't you? Could you mention a couple of those for us?
Certainly. Well, in the legislation that I just mentioned, we had a fantastic partner called Elder Voice Family Advocates. They were really a true grassroots group in that they were family members they were family who had lost loved ones through neglect or abuse in assisted living facilities. And they somehow found each other, formed a group, and were at the Capitol, I think, almost every day fighting for their loved ones. They were a great partner. They kept us motivated. They brought so much energy. They brought stories. They were just a great partner to have in that. But we do partner with other organizations on a number of other issues. For instance, on some of the work we're doing around prescription drug costs, we have a coalition that's starting to form around that issue. We have co-hosted rallies at the Capitol with Insulin for All advocates, Take Action Minnesota, SEIU Minnesota Healthcare, just a number of great partners who really broaden the reach that we have, but bring different perspectives to the issues that we're talking about.
Well, isn't that one of the priorities on your list for 2020, the theme of Stop Greed RX?
Yeah, Stop RX Greed, yes.
Stop RX
yes.
Greed. Tell us a little bit about what that effort entails, and it's very timely, and I'm sure that there's going to be a lot of activity around it, a lot of discussion. So tell us what AARP has in mind and how they're going to approach that.
One of the concerns that we hear over and over again from our members is the high cost of prescription drugs, not just for themselves, but for their family members, for their grandchildren. Americans are paying the highest prescription drug prices in the world. And we think that that's not right. Too often, people have to choose between filling a prescription or buying groceries or paying a utility bill. Those outrageously high prices don't just impact individuals in their pocketbook on a day-to-day basis, but they increase taxes, insurance premiums, deductibles. We know that this is driving up the cost of healthcare. So we launched a campaign earlier this year to urge all lawmakers, state and federal, to fight to stop drug companies from unfairly price gouging Americans and Minnesotans. This will be one of our priorities moving forward, and there's a number of ways that a number of bills that we think will help impact that, and I'm happy to go into detail about those a little bit.
Well, sure. One of the things I know that AARP worked on was getting petitions signed. And I worked at the AARP booth during the state fair this year, and it was amazing how many people would stop by and talk about the cost of drugs and how it impacted their lives. And this is one of the examples of an advocacy program that doesn't apply just to seniors or people over 50. Everyone at every age level experiences this overpriced drug use if that's something that's required in their medical itinerary. But yeah, maybe you could reference a couple of the bills that you will be working with the legislature here in Minnesota on this coming year.
Yeah. Well, on a federal level, we really have three priorities under the Stop RX Greed campaign. And first and foremost is to allow Medicare to negotiate directly for the cost of prescription drugs. Under current law, Medicare is barred from negotiating directly with the drug makers for a better price. We think that that is one of the first steps in lowering drug costs for a large number of our members. It also, the Congressional Budget Office shows a very large savings to taxpayers in the federal budget if that were to be allowed. We are also looking for ways to get generic drugs to the market faster. One of the specific ways is to ban pay for delay. What pay for delay is that a brand name drug company, let's say they're nearing the end of their patent period on that drug, they will pay a generic company to delay getting that drug, to creating that drug. We just think that's wrong.
That sounds like a payoff to not do something, doesn't it? Doesn't sound fair.
Yes, it's not fair at all. And it's keeping life-saving drugs out of the hands of consumers. The last piece of federal legislation we're really looking at is capping out-of-pocket costs for Medicare Part D beneficiaries, as we know that would really help a large number of people. On a state level, some of the things we're looking at are a little different because, federally we can work with Medicare, but here in the state, we can't necessarily do a lot to control what happens within Medicare because it's a federal program.
Sure.
However, there are things we can do to influence the market and to make drugs more affordable and accessible to people here in the state. One of the bills that will really be focused on this legislative session is to create the bill, if passed, would create a commission or a board that would oversee affordability of drug prices. So if you think about how a public utilities commission works, when
right. Yes.
Yeah, when someone wants to raise the energy rates for residents, they would have to go to the Public Utilities Commission with a proposal. There would be a public comment period. There's kind of a quasi-court case that happens and a decision is made. It wouldn't operate exactly like that. Instead, there would be reporting to the commission They would review the drug prices. It really just brings more transparency to the conversation. And there's a couple other bills in that I think support that work. There is a bill that would require transparency of price increases.
Sure.
And then the other bill empowers the Attorney General to take action if it's shown that a drug maker is price gouging and that the price increase is unconscionable. We think those three bills together have a lot of power and a lot of impact for consumers in Minnesota.
Is there any provision in any of these bills that would make it easier for people to get their medications from Canada, as an example? I mean, I have a friend who that's where he goes to get his medication at a considerable saving as to what he would have to pay here in the U.S. market.
Right. Those three bills in particular don't allow for that, but we do know that there's talk at the Capitol of putting a bill forward that would allow Minnesota to import prescription drugs from other countries, Canada being cited as one of those, and we anticipate seeing that. And AARP does support the importation of prescription drugs.
Very good, very good. Looking forward to when the legislature's back in session, are you getting any signals about how receptive the legislators might be to some of these bills that you're going to be advocating for?
I think what we've seen with prescription drug prices, you said earlier, this is something that impacts everyone regardless of age. We've also seen that people from all political leanings and ideologies agree that it's wrong to charge the prices for prescription drugs that American consumers are faced with. We see a lot of bipartisan support for a number of these bills. The Affordability Commission that I mentioned, in fact, that is being championed by Senator Scott Jensen, who's a Republican from Apple Valley, and then Representative Kelly Morrison, who's a Democrat. We've seen a lot of collaboration from both sides on this issue. And on the federal level, the House passed a bill last year. And the Senate has a bill that's being led by Senator Chuck Grassley. There hasn't been a lot of movement on that yet, but I think that lawmakers are open to this. I think they know something needs to be done. And in fact, they're impacted by this as well.
Well, yes, they are. I mean, they're humans, and they have the same medical needs that many of the rest of us do. Talk a little bit about the process that you use, the resources that you call on to help you with these advocacy efforts, in particular as how it might relate to AARP members. I know kind of a grassroots kind of approach to it.
Well, I think in my role, basically how we get our work done is through our members and through a team of advocacy volunteers. They are the advocacy volunteers that we have for the state of Minnesota. They are my partners in this work. They are the voices. They do so much of the heavy lifting on this. And typically, we train them on the issues. We talk about the policy. We talk about the facts when it comes to these issues. But when it comes down to it, they're the ones at the Capitol telling their story and saying, this is how this impacts me. And they are really bringing that human face and voice to the issue.
And the voters that the
And
legislators
the voters, yes.
will listen to.
Exactly.
Do you need more volunteers to help you in
Always.
this effort? Well,
Always.
if we have some viewers who are interested, I think your phone number and your email address is being displayed during the program on the screen. So if anyone is interested that would like to get involved and work with you, they're invited to contact you, right?
Definitely. No experience necessary. We just need someone who has passion and a drive to talk about why these issues are important.
It's that simple, isn't it?
It's that simple.
You know, you used a word that I want to back up and ask you to explain a little bit more. You talked about bipartisan support for many of these bills. The advocacy that AARP does is nonpartisan. And I think we want people to understand that it's not about working to get political parties in one position or another, or to help get people elected. It's not that kind of advocacy that AARP does. It's more around the legislative and the regulatory efforts that impact people's lives. And I think that's an important message for the public to understand.
Yeah. We advocate for issues, not candidates or parties. AARP does not have, we don't give money to candidates or political action committees. We don't endorse candidates or parties. We are simply there to advocate on the issues that matter to our members.
And that's a great distinction that we would like to have the people to understand. What are some of the challenges that you face in the role that you have? I mean, it seems like, working with the legislators, like you said earlier, the bills that you got passed this past year, you worked on them for a long time, for years. So it takes persistence and patience and contacts with people. Tell us about some of the things that work effectively for you in your role.
Well, I think persistence is key. I always tell people policy making is slow, but that's not a bad thing, right? It's people's lives who are impacted. We want to make sure that things are right and that there aren't going to be unintended consequences. But I think what works is that human voice, making sure people understand how the process works, making sure they understand how the issue impacts them. But I think more importantly, what I find is once people realize that it is as simple as reaching out to your lawmaker and saying, I want to talk to you about this, particularly here in the state. A lot of people don't think they can just walk up to the Capitol and go to their lawmaker's office and request a meeting. And are often surprised that their lawmaker will meet with them, and sometimes even, when they're not in session, sit down at a coffee shop and talk to them about an issue. I think that can be one of the biggest challenges, is that people, the Capitol is a large, beautiful building that can be a little intimidating, and people don't always understand that that's their building. That's where their voice is heard. I also think a lot of people, one of the challenges is people often don't think that their story matters. They might be impacted, but they don't think that, well, I'm just one person. If I
no one's going to listen to me. No one cares what I think.
Right.
Well, if you don't tell them what you think,
exactly,
then certainly they couldn't care.
Yes, and helping people, really empowering them to say, no, this is your chance. This is your voice. You elected this person to make a difference and to represent your views. And if you're not sharing your view or how you're impacted, they're never going to know.
True. But advocacy, while it's extremely important, and you've shown that AARP and the organizations that it partners with and the AARP members that work with you can be effective and get things done, advocacy is not the only program or the only benefit to AARP. Could you tell us a couple of more things about what AARP does that people should know more about?
Yes. We share information, not just on advocacy. We have a fraud watch network that helps people, educates people on how to protect themselves from frauds and scams. AARP is also very, one of the cornerstones of our organization is volunteerism and service. We have a number of volunteer opportunities, but we also connect our members with volunteerism, which one of the goals around that is to build community, keep people connected, but we also here in the state, we also want to have fun. We want to offer some fun to our members. So we do a number of community events locally that our members can join. And it simply is, you know, it could be a bike ride, a canoe trip, brewery tours. AARP is
a movie.
A movie. Yes.
I got to see one of the recent releases, Midway, that AARP made available free to the members who registered to come in and see it. And what a great thing to do.
Yeah. So, I mean, so fun and ongoing education. So we do offer classes out at our information center, which is located at the Mall of America. And it can be on anything to decluttering your home to preparing to sign up for Social Security. And we bring in partners who are experts on that in order to offer those educational classes.
I think those are great things that AARP is engaged in and committed to. In the couple of minutes that we have left for the program, Erin, any particular message or request or plea that you want to get out to get people more engaged or more aware, perhaps we start with that, about the advocacy program?
I would just wrap up by saying, you know, we need you and we want you to join our efforts. This prescription drug fight is going to take every voice that is able to come up to the Capitol or able to contact their lawmaker. Pharma, which is the lobby for drug makers, they are a very well-resourced organization. And that's not to say that, you know, AARP is not either. But they do have a lot of influence, they have a lot of dollars. What they don't have are the 38 million members that AARP has.
Or the 675,000 here in Minnesota.
Yes, and we need every single voice, every single person to take at least 1 minute to reach out to their lawmaker on this issue.
So if you're interested in this very important advocacy program for Stop RX Greed and you would like to help Erin and AARP, we have the contact information. It was made available on the screen. Please come and join and support and help get these bills passed that will bring down the cost of drugs or help control the ongoing increases in the cost of drugs. Our guest has been Erin Parrish, the Associate Director for Advocacy for AARP here in Minnesota. Erin, thank you very much. A great message that you shared with us today, and we wish you every success in your efforts to control the cost of drugs or get the cost of drugs down, and other programs that you advocate for as well. So Erin, thank you very much.
Thank you.
And perhaps we can have you back to talk about successes next time that you've realized.